Joining us now is Dr. Robert Murphy. He's a professor of infectious diseases at Northwestern University Feinberg School of Medicine. Good morning.
Good morning.
Is this emergency use that you've used that phrase? And I know that some people that phrase makes them nervous. I think to them it means untested. What can you explain that?
Yeah, no, it doesn't mean untested. But when vaccines are approved, they usually don't approve them on the market until there's about a year of follow-up, a minimum of 1 year of follow-up. But because of the pandemic and because, as you just said, 745,000 people have died, number 3 cause of death per year in the United States, what they did is they allowed the use of the product until they get all that data. But there are sentinel groups that are more than a year out. You know, the groups that were in the studies of Moderna, Pfizer, and Johnson & Johnson are way out over a year. And that's why Pfizer was one of the first ones. That's why they've got full approval now for adults. So it's not really, it's not investigational, really. It's just an early release because of the pandemic.
Talk about the Moderna not getting the green light from the FDA for kids ages 5 to 17. What is the real risk of myocarditis? Explain that.
Yeah, the real risk of myocarditis is very low, extremely low, way, way, way less than 1%. And most of those resolve spontaneously. Most don't even end up in the hospital. But there have been a few, and there may have been 1 or 2 deaths. But you know, it's a serious side effect, and they're looking at this very closely. And they want more data from Moderna, and Moderna may have to go back and actually study more kids. We don't know exactly what the plan is, but it's not getting approved now. Now, the good thing is the Pfizer group did get approval for that group, so kids have an option. It's that low dose Pfizer for the young kids.
All right, let's get to viewer questions. Why do places require 2 negative COVID tests? What is the timeline from exposure to symptoms to testing?
Yeah, no, this is a great question. People have to understand this. After you get exposed, say you get exposed on Sunday, you are probably not going to get symptoms till Thursday or Friday. And your test may not turn positive till Wednesday. So if you had the test, say you get exposed Sunday, if you had the test on Wednesday or Thursday, it might be negative, even though it's a good test. So that's why they're requiring 2 for people that don't have any symptoms.
All right, next question. If my teenage sons both got myocarditis from the Moderna vaccine and I had Johnson & Johnson, should I get the Pfizer booster even though Moderna is supposedly more effective?
Well, this is an interesting question. You know, the booster that this woman can have is really either the Pfizer or the Moderna. The Moderna booster is also half the dose of the original one. She had the J&J. She needs a booster because everybody needs a booster 2 months or later. Now, the myocarditis, if you get that side effect, it's mostly young men or boys. Very few women, and then the older you get, the fewer people get the side effects. So she's a little bit older, she's the mother, and she's a woman, so she's at very low risk. But she has an option. She can take the Pfizer if she wants.
All right, next question. My husband just received the Moderna booster and had the same side effects as his second Moderna shot. Does that mean the effectiveness of the vaccine was weakened with time?
No. Keep in mind that the side effects you have don't have any relation to the efficacy of the vaccine. So they can be related, they can not be related. It makes no difference. So forget about the side effects. These vaccines all work just about the same.
All right. If you didn't get your question answered by Dr. Murphy, he answers them bi-weekly on Northwestern University's Institute for Global Health Facebook page. You can also submit questions via email or head to our morning news